The name of the drug, Ampicillin-Sulbactam sodium. The therapeutic class is antibiotic, and the pharmacology class is aminopenicillin beta-lactamase inhibitor. The available form, injection, vial and piggy bank vial containing 1.5 gram and 3 gram. The vial containing 1.5 gram contains 1 gram of ampicillin sodium and 0.5 gram of sulbactam sodium, and then the vials containing 3 gram contains 2 gram of ampicillin sodium and 1 gram of sulbactam sodium. And then the indications and dosages, it is a just dose for all indication. If the creatinine clearance in adult is 15 to 29 29 milliliter per minute per 1.73 meters squared, give 1.5 gram to 3 gram to 3 gram every 12 hours. And then if the creatinine clearance is 5 to 14 milliliter per minute per 1.73 meters squared, give 1.5 gram to 3 gram every 24 hours. And then the indications and dosage, and then it is the ampicillin sodium sulbactam sodium is used to treat intra-abdominal gynecologic and skin structure infection caused by susceptible risk. And then in adult, give 1.5 gram to 3 gram 1.5 gram to 3 gram IV or IM every 6 hours. Yes, every 6 hours, and then do not exceed 4 gram per day of sulbactam. And then in children age 1 or older weighing 40 kilograms or more, for only skin and skin structure infection, give 1.5 gram to 3 gram IV or IM every 6 hours for no longer than 14 days. Do not exceed 4 gram per day of sulbactam. And then in children age 1 or older weighing less than 40 kilogram, for skin and skin structure infections only, give 300 milligram per kilogram per day, and divided doses IM or IV every 6 hours for no longer than 14 days, and then do not exceed 4 gram per day. And continue therapy with an appropriate oral anti-infective agent if necessary. And then the action of this drug, it inhibits cell synthesis during bacterial multiplication. So the ampicillin sodium sulbactam sodium is a combination of the B-lactam and B-lactamase inhibitor. The ampicillin works by binding to the penicillin binding protein to inhibit cell synthesis. So the penicillin binding protein, it acts to inhibit cell synthesis. The penicillin binding protein, it acts to inhibit the immature peptidoglycan. The penicillin binding protein, it acts to inhibit the conversion of immature peptidoglycan to mature peptidoglycan by directly inhibiting the bacterial transpeptidases. So when we say transpeptidase, it is the bacterial enzyme that cross links the peptidoglycan chain to form rigid cell walls. So the ampicillin, it works by binding to that PBP, and then it causes the disruption of the bacterial cell wall and leads to bacterial cell death. While the sulbactam sodium, it is the irreversible inhibitor of the B-lactamase produced by the bacteria. So this B-lactamase, it is produced by the bacteria because it is the bacterial enzyme that provide multi-resistant to B-lactamase antibiotics such as cephalosporin, penicillin, and other drug. And also the sulbactam, it works to prevent the B-lactamase produced by the bacteria from reducing the antibiotic activity. And then the adverse effect of the ampicillin sodium sulbactam sodium in cardiovascular thrombophlebitis, in GI tract diarrhea, in hematologic agranulocytosis, thrombocytopenia, leukopenia, thrombocytopenic purpura, and in skin it causes pain at injection site, thrombophlebitis, and rash and urticaria, and other adverse effects are hypersensitivity reactions. And then this drug is contraindicated in patient with history of cholestatic um, contraindicated in patient with history of cholestatic jaundice or hepatic dysfunction associated with ampicillin-sulbactam sodium, and then use this drug cautiously in patients with drug allergy, especially to cephalosporin, because of possible cross because of possible cross um, because of possible cross sensitivity and in those with renal impairment. So avoid taking a pill sodium sulbactam sodium with allopurinol, because it may increase the risk of rashes. And then avoid also taking with hormonal contraceptives, because it may decrease the effectiveness of the hormonal contraceptives. So advise to use other contraceptives during therapy. And then avoid also taking with methotrexate, because it can increase methotrexate level, increasing risk of toxicity. And then the nursing consideration for this drug is the drug is expressed as a total drug. The drug is expressed as total drug. The drug contains 1.5 gram 1.5 gram 1 gram of ampicillin sodium, and 0.5 gram of sulbactam sodium. And then um, in patient with renal um, in patient with impaired renal function, decreased frequency of administration. And then monitor liver function test result during therapy, um, especially in patients with impaired liver function. And then if large doses are given, or if therapy is prolonged, bacterial or fungal superinfection may occur, especially in elderly, debilitated, or immunosuppressed patient. And then watch for signs and symptoms for hypersensitivities, such as erythematous, maculopapular rash, um, and anaphylaxis. And then monitor for CVOD, or Clostridium difficile associated diarrhea, because it which can be fatal. And then antibiotic may need to be stopped if other treatment began.